Good morning and welcome to the Genesis Medical Podcast. My name's Nicholas. Today we're here with Dr. Ellent and we're going to be talking about cancer treatments and how it has evolved, what has changed. And Dr. Ellent, why don't you tell us a little bit more?
How you doing, Nick?
Good. Thank you.
So, cancer therapy is evolved over the years, but the story of cancer therapy, the way as we know it, started in 1918. 1918 is when, during World War One, gas was used, mustard gas. It was very toxic. It was phenomenal mortality, but what they also found is that some people, or most of the people, had decreased white count. So at that time, thought, listen, we have a lot of diseases we don't even know how to treat, lymphomas, leukemias, where white count is high. What if we give mustard gas to those patients? See what happens. And it actually, in some cases, worked. So the mustard gas, which actually later evolved into adriamycin, but going back to mustard gas, in 1963, uh, I had a patient who in 1963, they put him on the board. He had lymphoma, and they essentially gassed him.
Oh, wow.
He survived. To this day, he tells me that if there is another treatment like that, he much rather die than go through this again. But he's alive. So that continued till about 1970s. In 1970s, we see emergence of, we can call it targeted therapy, cisplatinums. So what cisplatinum is basically platinum agents. They started, we noticed that they can attack cancer. Again, they were very toxic. They kill cancers, but toxicity was phenomenal. It's nausea, vomiting. It's whatever you think bad about chemotherapy. I thought we could be associated with high doses of platinum. However, also in 1970s, 1980s, we started to divide them in smaller dosages. And once we start dividing smaller dosages, it started to be more tolerable. We started to find the treatment that counteract the side effects, anti-nausea medication, for example, Zofrans. We started able to use better steroids. The allergic reaction associated with chemotherapy also started to be treated with now we use Pepsids, Benadryls, and different modification of steroids to decrease the allergic reactions. So we start looking at the side effects and dividing the treatments. In 1989, uh, there is a disease called CML. And what we found, this disease had kind of very interesting configuration of cells. At the time, we didn't know what it does. All we knew that chronic myelogenous leukemia is deadly. People die 2 3 years. And in 1989, a magic bullet was formed, Gleevec. What Gleevec did, it's very small molecule. It went as the key into this malformation inside the cell and killed the cell. And now people with chronic myelogenous leukemia started to live. They started to live instead of 2 3 years to live, 15, 20, 30 years. And now we're having multiple generations after the Gleevec, and it has phenomenal response. It also has some response in some other cancers, uh, but it was the key to further research and further understanding and how we can treat certain diseases. At the same time, we start finding that the certain molecules, certain cells, the way they communicate with each other, they have flags, epitopes, and those flags show I'm this I'm this cell. I produce this. That's what I produce. That's what I do. So that was what if we find the antibody or the molecule to attack the cell with this flag? See what happens. So one of better known as rituxan. It's anti-CD20 antibody. CD20 is the epitope that's found in the immature B cells, but also found in many lymphomas, certain leukemias. So I give people a rituxan, and suddenly we have positive response. People live longer. So, cancer cells are known to produce uh, pathways to feed on the body with irregular vessel formation. So I thought, what if we destroy this new vessel formation, and we'll see maybe cancer cannot grow as well. That's how Avastin came around. Avastin is vascular endothelial growth factor inhibitor. What it does again, molecule that kills this cells, the new vessel formation. Same thing with Herceptin, where in breast cancer we see that marker, and suddenly we can kill it. Absolute revolution. Around 2010, we entered another revolution, and that's immunotherapy. So immunotherapy, whenever cancer, in a way, it's a failure of immune system to pick up that we have cancer. But what if we adjust immune system? What if we make it more aggressive? Now, cancer cells are smart. They don't want to show the flag that can, knowing that it's going to kill them. So they hide the flag. So immune system doesn't see it. What if we force the cancer cells to show the flag? And so combination therapies or immunological therapies that we do right now. If it's Keytruda, Opdivo, that's PD-L1 blocker. That's basically forcing the immune system, revving up immune system to attack. We also have another drug that actually was designed here in Houston, Yervoy, where we're forcing these cells to show what they produce, what they are. So immune system can attack it. And we have phenomenal long-term responses. We are in the middle of revolution where it's not just the chemotherapy. It's not the old master gas of 100 years ago that we gave to people. Now it's different.
Is there anything that you would like to see or produce that can kill cancer faster or treat cancer?
Of course. And it's all going to be going back to genes. It's all the details, detailed knowledge. And nowadays, therapy for cancer, it's very important. It's almost for each individual person, depending on what the genes are. If they have PDL1, if they have any other markers. And based on those markers, we can pick what exactly therapy will work. And I think the future is that design chemotherapy. The future is to minimize the side effects. The future is to give people life with limited side effects, but longevity.
Quality of life.
And that's probably the most important thing in any treatment. Treatment should not, it should help.
Yes, sir.
And people have to understand in cancer, it's cancer itself that makes people weak. Cancer itself that forces us to eat the body. Each individual cancer patient, they look the same, muscle wasting. We have to fight it. And now we have more and more tools to fight it. It's phenomenal developments. Future is good.
Well, that's awesome. Thank you, Dr. Ellent.